But now we have to truly test the muscle, how it's used in function. So if we look at the cadence, or the speed that Nick went through while running, we notice it says he has 150 beats per minute, or steps per minute. Divide that by 2 because he has 2 different legs. We're at a cadence of 75 per leg. So if we set the cadence and the metronome, just like so, to 75, then we could test the strength of the muscle at the speed that it generates force. And so in order to do this, we put the patient in a manual muscle test position. We stabilize through the upper quarter to prevent any pelvic rotation. We expose the lumbar region for any compensations. We have a pillow that's placed between his thighs. And this is going to be if I can generate my force enough to have his knee hit the pillow, this would be a failed test. I grade this test normal, subtle, or obvious. And obvious would be a positive test where the knee hits the pillow. We set the metronome. And when we set the metronome, I'm going to apply my force as mass times acceleration, the acceleratory component of providing impulses at the same cadence that he's running. Our standard manual muscle tests only have mass. It's a sustained contracture. This is incorporating acceleration. So let's go ahead and perform this test. I'm going to hit the metronome so he can pre-anticipate how much I'm going to press and when. I'm going to put him in the position and go ahead and hold. End of test. You can relax. So what did you notice? Well, previously, as you remember earlier in this course, we did a manual muscle test, and he could isometrically hold that strength. But then, when I added an acceleratory component, specifically at his cadence, he was unable to hold. The test was failed, and his knee hit the pillow. So this gives us an assessment that there's a difficulty generating force at a specific speed.